I'm Vivek Goel. I'm a gastroenterologist based in South Wales and Newport and Cardiff. Since I joined medicine more than 25 years back, I've been fascinated by gastroenterology. I guess my first uh, interaction with gastroenterology was from my relatives and friends who always seemed to have some tummy problem or the other, and they would be asking me questions about it. So it's a very common condition which affects many people. And I felt, that it is something where I can actually make a difference to people. Some of our patients have got life-changing conditions, which makes them literally housebound or unable to do anything or unable to hold a job. Most of our patients are actually very young. And the treatments we have had in the last 10, 15 years, maybe 20 years, have been life changing. And it has given me such a huge pleasure and sense of fulfillment that being able to help these people. And that is what made me choose gastroenterology. As I said before, it is this ability to help and make a difference to people's life, make it have an intervention which I can actually change things. So, for example, I do a lot of endoscopy. In I do bowel screening. I remove large polyps. Those polyps could, over a period of time, turn into cancer. So, actually, the procedure I'm able to do can actually, avoid having cancer for my patients, which is rewarding. Again, secondly, as I talked about patients with colitis, inflammatory bowel disease, and many such conditions, patients have a lot of problems with their tummy, a lot of pain, and they are all in the younger age group. And ability to offer them treatment so that those conditions can improve, and they do improve in most of those cases, and for them to see them live a fulfilling life, having families, getting a job, something which they couldn't do or struggle to hold down before treatment, is very rewarding for me, very fulfilling, and gives you a reason to actually get up in the morning in a way. When patients come to see me, I will take a detailed history, uh, looking at what their condition is, their any problems or medical condition they've already got, treatments they've had, and lifestyle issues that they've got. And after that, I would examine patients, usually in the presence of a chaperone. And following this, I would discuss a management plan. In the first visit, usually we would need to do some more tests because it is not easy to diagnose something or to confirm a diagnosis without tests. So they would need tests, which could be in the form of scans, which could be in the form of blood tests, or an endoscopy of some sort, like a gastroscopy or a colonoscopy. Once they've had those tests, in the vast majority of cases, we are able to give a diagnosis and then plan further treatment of how to relieve their symptoms, how to improve their condition. And usually that is the way the clinical interaction goes.